It's very important to understand the electrode and the electrode interface, the interface between your unit, the device you might be using, the lead wires, and the patient is really, really important to driving good outcomes and providing good therapy. So here are some key points to remember when you're using electrodes. Number one, electrode life. So this has to do with the manufacturer's labeling that they'll have on a pack of electrodes. Okay, most quality electrodes will display somewhere on the packaging the number of treatments that the manufacturer guarantees or recommends to ensure good quality outcomes and good therapy. For example, you might see in the upper right-hand corner of a pack of electrodes the number of treatments with a circle or a number that will indicate the life of that electrode and guaranteed by the manufacturer for electrotherapy applications. Number two, skin contact. This is really, really important. Good contact of the electrode on the interface of the skin will help distribute the current flow more evenly throughout the surface of the electrode, whereas poor contact to the skin will cause a smaller surface area for the current to have to flow through, thereby causing a more intensity and it could be more uncomfortable to your patient. Number three, electrode equality. Keep in mind, not all electrodes are created equal out in the marketplace, so consider a higher quality electrode equals lower resistance of the electrode, which allows for better comfort and more effective treatments. Low-cost electrodes equal higher resistance levels, which equals more intensity to achieve the physiological effect you're looking for and can cause patient discomfort and reduced outcomes. Using beyond the manufacturer's labeling could equal patient discomfort and reduced outcomes. Again, because resistance levels are increasing over the span of that electrode and again could cause more discomfort to your patient. Device malfunction. Devices have a safety feature built into them. Most devices do, from an electrotherapy standpoint, that if it measures too much impedance flow of the conductance of the meter inside the device, then the device will malfunction or not go any higher as a safety feature. A lot of overuse of electrodes is a main cause for that particular issue. And electrode size and electrode placements are very important factors, which I will cover. Number four, single patient use. This is important. Most electrodes on the market are intended for and labeled for single patient use only. This really has to do with infection control and preventing cross-contamination of bacteria from one patient to the next. Skin prep. Make sure you understand that prepping the skin and cleaning it helps to deliver the current more effectively. So always clean the skin to remove dirt, oils, dead skin with a clean washcloth and soap. Avoid using alcohol-based wipes. This has the effect of drying out the hydrogel adhesive of your electrode, which will cause more resistance on the surface of that electrode, which causes a lower level of current flow, which forces the therapist to increase the intensity of their device and can be more uncomfortable to the patient. Okay, let's talk real quick about electrode size. Size matters when you're delivering electrotherapy. For example, I have on my arm, my forearm here, a 2-inch square electrode. Very common in the market. You can also use 2-inch round electrodes. Well, these are good for smaller body parts or smaller surface areas or smaller muscle groups that you're working with. But more current is flowing through a smaller surface area, so the density of that current goes up. It recruits fewer motor units in the target tissue that you're going after for your therapy. But like I said, it's good for smaller body parts. Whereas if you're using larger electrodes, we're talking about 3-inch round, 2.5 by 3.5, 3 by 5. These are just examples. There's a larger surface area of those larger electrodes, so it causes a decrease in your current density, which equates to more comfort to the patient. It does recruit more motor units because we're covering a larger area, and again, good for larger body parts, larger muscle groups. One word on electrode placement. This is another important factor in your electrotherapy applications. Electrodes should be placed so that the flow of current can reach the target tissue. The farther apart your electrodes are placed on the target area, the deeper the current will flow. Keep that in mind when you're looking to do an application and you're targeting specific muscles and recruiting specific muscles. Whereas if you place the electrodes closer together, you're going to have a more superficial depth to that current flow. And if they're placed too close together, the potential it does exist for more discomfort to the patient. One last note that I will make, consider using an antimicrobial electrode, such as microblock, to help prevent cross-contamination of bacteria in your clinic and from one patient to the next or from one staff member to the next, and help improve your infection control protocols.